Hello, everybody. My name is James Ahi, and for this week's article critique, I've chosen to go with an article published by Schroeder, Frank, Sharp, and Lee in 2019. That is comparative effectiveness of aerobic resistance and combined training on cardiovascular disease risk factors. So a little bit of background information of the study. Cardiovascular disease, also known as CVD, is basically just a general term for conditions that affect the heart or the blood vessels. Now, this is usually associated with atherosclerosis, which is basically just buildup of fatty tissue in blood vessels or arteries. Now, according to heart.org, in 2016, nearly 121.5 million adults suffered from some type of CVD, which is nearly 48% of the adult population in the US. Lifestyle modifications are often the first lines of therapy to treating CVD patients, rather than a traditional prescription medication. So jumping into the purpose and study design, the purpose was to test different methods of physical activity training and their effects on a range of different CVD factors. And this study utilized a randomized experimental control study. A little bit about the participants. So when the researchers first gathered their group of people, they numbered in close to 300 people. And these 300 people went through different criteria, and an example of their criteria for excluding people were those who smoked, pregnant women or women who anticipated pregnancy, those who planned on being away for more than 2 weeks, and those who had family or other issues that would prohibit them from participating in a study such as this. And so once all of the participants had gone through two different criteria and orientation, we were left with 69 adults, all aged from 45 to 74 years of age. Of these 69 people, 61% were female, and of these women, 83% were postmenopausal. Now, this postmenopausal statistic is a little interesting because, as it states here, heart disease risk rises for everyone as they age, but for women, symptoms can become even more evident after the onset of menopause, depending on what sort of lifestyle you live. Now, 93% of these participants were white, with the other 7% being classified as non-white. And these individuals were recruited based on high blood pressure levels or hypertension, sedentary lifestyle, or if they were classified as overweight or obese, they were also measurements. Participants were divided randomly into 4 parallel groups, which really only differed by the physical activity that was going to be performed throughout this trial. Now, these different categories were aerobic exercise only, resistance exercise only, a combination of both aerobic and resistance, and lastly being no training at all, which would be the control group. Now, in the actual measurements, peripheral and central blood pressure, as well as resting heart rate, were measured using a bicep cuff. BMI was calculated using measured bodied weight and height. Cardiorespiratory fitness was also assessed by utilizing a submaximal treadmill exercise test. Maximal contractile strength was assessed with a seated chest and leg 1 rep maximum, following the standard procedures of that. And lastly, a 5 milliliter venous blood draw from a superficial arm vein was obtained. And now this was obtained to assess lipid profile, being total cholesterol, density of lipoprotein cholesterol, triglycerides, and glucose. Another important measurement fact or variable was CVD risk score. A CVD risk score could be calculated using an atherosclerotic cardiovascular disease questionnaire. Now, this questionnaire asks people about their eating habits, their physical activity habits, and whether or not they've experienced or have been told by their doctors that they need to start changing things. This risk factor score was calculated before and after exercise interventions and compared across the 4 groups. Moving on to statistical analysis. A Bonferroni correction was applied to correct for multiple comparisons between these groups. And now what this does is it adjusts probability values because of the increased risk of a type 1 error when making multiple statistical tests. Now, all of these variables were reported with a 95% confidence interval, and the main factor here was the relative risk that was being measured. Some of the confounding factors that were adjusted for in this study were age, sex, and baseline values of each outcome variable. So table 1 is the results for baseline values of each group presented with the standard deviation. Now, this was taken before any exercise intervention started. As we can see here in this left category, we can see kind of the group as a whole, and then it goes and it uh, moves them into their 4 groups and gives you a baseline of those 4 groups as a whole. Now here, table 3 represents the changes in body composition, cardiorespiratory fitness, muscular strength, blood glucose, and lipids. So we have our characteristics here, and we can see in the aerobic and resistance categories, we see a lot of negative values, which means things really just got worse. It's not until we get over to the combination category where we can finally start seeing some positive values, which means something that was happening in this combination group was going right and something was getting better. It should also be known that these measurements were taken objectively, which eliminated the possibility of over or under reporting. Moving to the discussion, this study was the first to focus on a range of CVD factors and the benefits that different forms of exercise have on said factors. A lot of the current literature that is available now focus on physical activity on specific CVD factors such as blood pressure or BMI. There's not really any literature besides this that I found that really looks at the CVD risk factors as a whole. So some major findings of the study include the prescription of a combination training regimen allowed for greater overall improvements in CVD risk factors. And going back to table 3, we can really start to see that, as I mentioned, these negative values really just mean stuff got worse. And the combination was the only real positive values that we could see there. Another major finding was that a combination of aerobic and resistant exercise training resulted in not only improved diastolic blood pressure, but it also increased lean body mass and increased strength and cardiorespiratory fitness, despite the exercise interventions only being about 8 weeks long. So some strengths of this study: the randomization of the study ensured that participants were comparable at a baseline in major confounding factors, like I said, age or sex. These orientation sessions that participants had to go through before reaching the actual study minimized dropout rates and allowed for high levels of adherence to program interventions, which is rare for a study. Even with 69 people, you expect to lose a couple people, in which they did. They lost 2 people out of one group, but that's a very minute number of people. So another strength were that participants wore a pedometer throughout the intervention period. This minimized the uncertainty about changes in physical activity outside the intervention. So most studies don't really account for any other lifestyle changes, and this study kind of tried to do their best to really focus on being able to account for those. Some limitations: researchers were unable to adjust values for any dietary intervention or other lifestyle changes. As I mentioned previously, they tried their best with the pedometers, but it was hard to really account for all the dietary intervention happening, as well as other lifestyle changes happening. Another limitation was that the control group was present in all of the lifestyle and diet educational teachings as the rest of the groups, which made for no true non-treatment group. So the control group wasn't a real control group. Cardiorespiratory fitness was also estimated using a submaximal treadmill test instead of a maximal effort. So it's important to really understand that because cardiorespiratory fitness was estimated using the submaximal treadmill test, that these values representing this could be could be off, could be skewed. The last limitation that I really focused on was that participants were mostly white women, which is not representative, in my opinion, of a total population who lives with high risk CVD factors. And there's a lot of men who also live with these factors, and there's a lot of different races that also are exposed to these different high risk factors. Moving to the conclusion, from the data reported in the study, it's clear that the combination of these aerobic and resistance training had a more beneficial effect on CVD factors than the individual training regimen, as can be seen and reported in Table 3. This paper was the first of its kind, and it really sets the stage for other studies to be done, which could also focus on multiple factors of CVD. And in my opinion, because of this new literature provided, it's really made a significant contribution to the field of physical activity and disease prevention. However, a longer study with a more diverse group of people should be performed to really understand how different combinations of exercise affect these CVD factors.